Hello everyone, in this video we are going to see about typhoid and I will be covering introduction, causes, predisposing causes, sources of infection, mode of infection, what is the incubation period, pathophysiology, signs and symptoms, diagnosis, treatment, complications, control measures. At last we will see about nursing care. What is meant by typhoid? Typhoid is an acute infectious disease which is widespread throughout the world, which is still common in Eastern Europe, South and Central America. Some people term typhoid as enteric fever, but this includes typhoid and paratyphoid. The main causative organism of typhoid is Salmonella typhi or typhoid bacillus or Heberdella typhosa. This slide will speak about predisposing causes of typhoid. First, we have age category. Person with the age group of 4 to 35 years are more prone to get typhoid infection. And coming on to the sex, male suffers more than females. Season, July to October is the most vulnerable season. Social status, it affects everyone. Occupation, people who are exposed to infection, especially medical professionals such as doctors, nurses, and sanitary workers. This slide will talk about the sources of infection. We get typhoid through an infected person, fecal carriers, persons over 40 years of age, especially females. What is the mode of infection? Typhoid will spread by direct or indirect contact, contaminated water, food, milk and drinks, raw vegetables and fruits, flies, shellfish, using contaminated articles with feces, urine. Incubation period. It usually occurs 10 to 14 days, but it may be as short as 3 days or as long as 21 days. Depends on the bacilli ingested by a person. Pathophysiology of typhoid. Due to the ingestion of contaminated food and water, it invades the small intestinal mucosa, that is the pars pastis, and enters into the bloodstream. Then the infection carried by the white blood cells in the liver, spleen and bone marrow. Then the bacterial multiplication occurs and it results in invasion of gallbladder. Finally, the infection passes into the intestinal tract. Then the patient will have the symptoms like fever and diarrhea. Signs and symptoms. When a patient is affected by typhoid, they will have fever, headache and backache, dry coated tongue, raw spots would usually be seen particularly on the chest and abdomen. They will have slight cough, depends upon the infection. Their heartbeats are usually feeble. Pulse rate is usually slow on comparison with the temperature and is dichrotic. General malaise. During convalescent stage, patient suffers from anemia, falling of hair. Varieties of typhoid. We have three different varieties of typhoid. Ambulatory type. In this type, symptoms are mild and thus the patient do not take risk. But sudden development of grave symptoms takes place and patient may even die due to the perforation of the intestine. In mild form, patient will have moderate fever with marked remission, diarrhea, usually rashes will appear. In abortive type, there is an abrupt onset of disease with severe symptoms but convalescence follow within a few days. Confirmation will be done by through blood test, that is viral test. Typhoid bacilli will be present in the serum. Hemoglobin levels will be decreased. ESR levels are elevated. In platelets, patient will have thrombocytopenia. In urine and stool examination, the bacilli will be present, both the stool and urine. Patient develops with the below complication: intestinal perforation, gastrointestinal hemorrhage, cholecystitis, anemia, pneumonia, and hepatitis. We can treat a typhoid patient in two ways. One is general method and the other one is specific method. In general method, symptomatic management, which includes maintaining adequate hydration and appropriate nutrition. In specific method, antipyretic drugs and antimicrobial therapy. The common medications are chloramphenicol, ampicillin, amoxicillin, fluoroquinolones. In case of quinoline resistant, azithromycin, third generation cephalosporin, ceftriaxone as prescribed by the doctor. What are all the preventive measures of typhoid? Human excreta must be collected and disposed of properly. Water must be chlorinated properly. People should take only pasteurized or boiled milk and milk products including cheese of pasteurized milk. Waste must be collected and disposed of daily to destroy breeding places of the flies. Food particles, where they are manufactured and sold, must be supervised properly by the food inspector to see that these articles are protected from dust and flies. Sanitary supervision is needed during processing, preparation and serving of all foods, mainly which are taken as raw. Arrange for taking adequate anti-fly measures and eliminating their breeding places by using screen doors and windows to prevent their entry. All the food handlers of public eating places, hotels or restaurants must have proper license. They should have periodical medical checkup. All the chronic and convalescent carriers must be trained for maintaining personal hygiene, that is, hand washing after defecation and before taking food. This slide will talk about 5 F's. Food. Food must be prepared with proper hygiene and should be covered with proper lids. Flies. We should follow anti-fly measures by using Nitlans. Fingers. We should follow proper hand washing technique. Feces. Human excreta must be disposed of properly. Fomite. We should avoid using contaminated shovels, clothes, bowls, buckets, brushes and other articles. Control measures of typhoid. We should report about the case to health authorities quickly. Once the patient has been diagnosed as typhoid, then the patient must be isolated in fly-proof isolation ward of the hospital. Quarantine is followed for the family contacts. They should not be employed to handle or serve food unless they show negative reports of cultures of the feces and the urine. All the articles used for the patient which are contaminated must be disinfected daily before using that for other patients after thorough cleaning and disinfection. Water must be boiled and chlorinated. All the vegetables and fruit should be washed off properly before we use it. TAB vaccination must be given to all those who are exposed to the case or carrier of the disease. If international travelers are not protected by previous attack or vaccination, then they must get vaccination as prescribed. Nursing care of a patient with typhoid. Follow preventive and control measures and also give specific treatment to the patient. Patient must be take complete bed rest in flat position and turn him or her on sides frequently to prevent from suffering bed sores. Patient's room must be well ventilated, ply-proof, clean and warm according to the weather conditions. Nursing procedures must be carried out with strict asepsis. Keep the mouth clean to prevent from bad odor. Patient must be kept very clean and change his clothes and linen on daily basis. Monitoring vital signs are very important. Note and record the temperature whenever required. Watch for rise of temperature, diarrhea, abdominal distension and other complications very carefully and inform about it to the doctor immediately. Diet is very important factor in nursing care of a typhoid patients. Soft and bland diet should be given. Fluid maintenance. Note, the diet should not cause flatulence. Therefore, the diet must be soft, nourishing and easily digestible. Thank you for watching this video. Hope this will be helpful. Please like, share and subscribe my channel.